Yes, I am live. Hello, everyone. This is tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester, and we are continuing our conversation about coronavirus. For the second week in a row, I have decided not to bring you what I had previously planned because obviously this is still a hugely important topic. It is still a very fluid situation, and I wanted to make sure that I was coming back on today to give you kind of some updates because a lot has changed since last Monday when we talked about this. So I am just going to wait about 45 seconds or so for people to hop on, and then we are going to go ahead and get started, continuing our conversation about coronavirus. If you missed last week's episode, that was a much longer episode than the normal Navigator Nuggets 2020 version. So I encourage you to go to my YouTube channel, and I will post the link here in this Facebook Live video. But I encourage you to go to my YouTube channel. You can search Your GPS Doc on YouTube. Like I said, I will post a direct link to the video, and you can see that entire video from last week, which was extremely informative because I'm not going to go back and talk about all those things again today. Today, I really want to focus on the updates and just to give you some additional information and recommendations that were not in place as of last week, okay? So again, we're going to get started in just a second. If you know someone who can benefit from this information, please go ahead and share the video. Feel free to share the video with individuals in your circle. This information, as always, is applicable to everyone, but as an independent health advocate who primarily works with family caregivers, I am definitely trying to make sure that those of you who have aging parents, aging relatives, those with chronic illnesses, whether you care for them directly or not, I want to make sure that you all have the information that you need. Okay, so that's going to be my focus for today. So welcome to all of you who are watching live. Welcome to those of you who will catch this on the replay. Let me just go ahead and introduce myself for those who may be watching this for the very first time. So this is Navigator Nuggets. This is a weekly Facebook Live show that I do every single Monday night at 8:00 p.m. Eastern Standard Time, right here on my Your GPS Doc Facebook page. And the purpose of Navigator Nuggets in general is to educate and empower individuals and their family caregivers so that you all can be effective advocates for yourselves in medical settings and so that you can get the health care that you need and deserve. So my name is Dr. Nicole Rochester. I'm a board certified pediatrician. I am a former caregiver to my deceased dad. I am an independent health advocate and the CEO of Your GPS Doc. In the interest of time, I'm not going to go into a lot of details about what I do, but I encourage you to visit my website, yourgpsdoc.com, where you can get a lot more information about that. So let's go ahead and get started. So again, last week we talked in depth about coronavirus 2019, also known as COVID-19. And so I am not going to do a full recap of that. I encourage you again to either scroll through this Facebook page or to check out the video on my YouTube channel. But very, very briefly, just as a quick synopsis, and I'm sure you all have heard this a million times because like me, you're probably glued to the television. I haven't watched this much television in probably like 2 years. But coronavirus is a respiratory virus. It originated in China at the end of December in 2019. This is a novel virus, meaning it is a new virus, one that we have not seen before. However, it is similar to some of the other coronaviruses that we have seen, like SARS and MERS. And this, right now, CNN is calling it a pandemic, I think. And again, this information I'm giving you all is accurate and up to date as of about 7:00 p.m. Eastern Standard Time on Monday, what's today, March 9th. So again, by the time I finish this broadcast, unfortunately, there will probably be more cases and more deaths. But, I'm giving you the information that was up to date as of 7 p.m. So, like I said, CNN is now declaring this a pandemic, which basically just means that this is a highly contagious disease that is spreading, across the globe. I think as of earlier this evening, the CDC still hasn't really pulled the trigger on that, but suffice it to say that this is a public health emergency. However, and I want to say this before I get further into this Facebook Live, we have to remain calm, okay? Yes, it is scary. Yes, there are people dying. Yes, it is highly contagious, but we have to remain calm. And in fact, if we begin to institute, many of which are just common sense practices, we can actually help to slow the spread of this disease. Okay. So again, it originated in China. It was a live market. At this point, they think it originated in bats, ultimately got spread from animals to people, and now is very actively being spread between people. Okay. And while the early cases in the US were all connected to travel to China, now, as you all know very well, we are now having what's called community spread, which means that the virus is passing from individual to individual. So we are now seeing cases in individuals who have absolutely no known connection to, foreign travel to some of the countries that have a high incidence. Okay, so I'm just going to give you the most up-to-date numbers again as of 7 p.m. Eastern time on Monday, March 9th. In the United States, there are 707 cases and there are 26 deaths. Now, I think last Monday when we did this broadcast, there were 6 deaths, if I'm not mistaken. I can't remember how many total cases, but it was much less than this, okay? We are seeing this across the country. I think if I remember correctly, it's in like 38 of the 50 states. It's in all the continents except Antarctica. So again, this is very widespread. Still lots of activity, increasing activity in Italy. Actually in China, the numbers are going down. And that's another reason, something else that I want to point out to you all is that in China, where this originated, and so we have the benefit of really seeing kind of the natural progression of this virus and what happened. So even though there have been lots of deaths in China, at this point, among the 80,000 who have been reported, the reported cases, more than 70% of them have recovered or are recovering, okay? And they have said in the past that 70 to 80% of people who get infected with coronavirus do very well, okay? So again, the majority of people who will become infected with coronavirus are not gonna have serious illnesses, okay? But of course, we are worried about those who are in that 20% who are subject to serious illness. And generally those with serious illness have developed pneumonia. So just to quickly recap the symptoms, it can start out just like a common cold, sore throat, runny nose, cough, congestion, and then it can progress to fever, worsening cough, difficulty breathing, and a severe pneumonia to the point where you need extra support, as in like you need to be on a ventilator. And then, some of those cases unfortunately have progressed to death. So the reason this is so important to the Your GPS Doc family and the Your GPS Doc audience is because I know that many of you are caregivers. Many of you may not even be direct caregivers, but you are in my age group and you have aging parents. You may even have aging grandparents or other relatives. And this is a huge source of concern for those of us who have aging relatives. And so again, I wanted to bring you some updated information compared to what I shared last week. Okay, so the reason this is also important is that we know that this illness, this virus, is much more serious in older individuals, and they're saying those who are older than the age of 60, as well as individuals who have multiple chronic illnesses. So far, and again, this could change, but so far, we really aren't seeing any serious illness at all in kids, which makes me very happy as a pediatrician and as the mom of 2 young adult daughters. So we really haven't seen that yet. However, we know that children and younger adults may indeed be infected with the coronavirus, but they may be asymptomatic, okay? And this is of significant importance because while we are happy that those younger individuals are not getting sick, the reality is that they may in fact still be infected, and that means they can transmit that virus to individuals who are at risk. And I'm going to come back to that in a moment when I talk about some of the recommendations, okay? So with the increasing spread throughout the United States and really across the world, what they are recommending now here in the US is that, they are recommending something called social distancing. So what does social distancing mean? Really what they are discouraging is large gatherings. So there have already been, as you all know, there have been concerts that have been canceled. There have been lots of conferences that have been canceled, and I'm sure that this is going to continue over the upcoming weeks and possibly even months. They are recommending that we not engage in non-essential travel. So if this is not something that you absolutely have to do for your job, or for a funeral or something, a really sick relative, things like that, they are recommending that Americans stop non-essential travel. They are recommending that we do not cruise. And so, if you have a cruise planned in the near future, the recommendation right now is that you do not cruise. And that is partly because, it's almost like a petri dish. You have these large groups of people all in one location, and there's buffets, and there's just countless opportunities for that virus to be spread from person to person, as well as from person to surfaces and thereby to other people. And so we have already seen, on several cruise ships, the rapid spread of coronavirus. And so that's the thinking behind that recommendation. We continue, unfortunately, to have deaths in Washington State in the Life Care Center facility, which is the nursing home that had, I think, the first case of coronavirus in the United States. And so there have been 20 deaths in King County, Washington. This is the state of Washington, and 19 of those 20 deaths originated in the nursing home. So we talked a lot last week about, again, why nursing homes are really prone to not just coronavirus, but to lots of infectious diseases. And we talked about some precautions that have been put in place and some recommendations. So I encourage you, if you missed that, to go back and watch that video again on my YouTube channel. So let's get back to the social distancing. So that involves, really discouraging large groups of individuals from gathering. And that also can include closing of buildings or restrictions on certain buildings, closings of schools and things of that nature, which we are already seeing. I think in Fulton County, Georgia, those schools are currently closed because a school official tested positive. They have not yet shut down all church services, but we do have a case here in DC. A priest has tested positive for the coronavirus, and so they are, communicating with individuals who have been in contact with him, and unfortunately, he served communion. So, you can just see how quickly and how easily this virus can be spread just by these, encounters that we have in our everyday lives, okay? And so what they are recommending is that, we really just kind of start to distance ourselves from, these large crowds, and to really decrease your chances of being exposed to the virus, okay? This is very, very important. And I know, I went to church yesterday. We're still doing the elbow bump like I talked to you about. I did have a couple of people hug me, and, I'm a natural hugger. So it's hard, it's hard to be in church with people that you love and with people that you are in community with, and to not hug. But that is absolutely the best thing and the right thing. And they are now formally recommending no hugs, no handshakes, none of that stuff, okay? So I encourage all of you to do that. Now, for those of you who have loved ones who are at significant risk, meaning they are over the age of 65 or they have multiple chronic illnesses, it is really, really important that you make sure that they are instituting and practicing this social distancing. This is not the time for them to, go to amusement parks or even, concerts. Whether or not you want to encourage them to stay home from church, that's a personal decision. But, I know we have a couple of church members whose family members have been older church members who family members have been discouraging them from attending church services, and that's certainly not unreasonable. If you yourself are sick, then you want to avoid contact with your elderly relative. You don't want to go visiting their assisted living facility, their nursing home, or even their private residence if you are sick with a respiratory infection, whether you have any known contacts or not, okay? Because at this point, we just don't know. And because people can transmit the infection before they are known to have the disease, any one of us watching right now could actually be infected, okay? You may have been in contact with someone who didn't even know that they had it, and 2 days from now, they can come down with that infection. So we just have to really be careful. I am hoping and praying that this is not going to go on for an extended period of time, but knowing that it started in China in December and is just now starting to, decrease in that country, and it's March. If that's any indication of what we are in store for in the United States, then unfortunately we may have a lot more time to have to deal with this, okay? Similarly, if you have young children who we know they are just hotbeds for infection, and again, the children are not really getting sick from this coronavirus, but certainly if you have young children and they are demonstrating any signs of respiratory infection, runny nose, coughing, sneezing, then you also want to avoid having them around your aging or your ill relatives, okay? This is not the time to go visit grandma, okay? Because we want to make sure that we keep our older relatives safe. So this is really, really, really important. And in terms of testing, so this has been a huge issue because initially they promised over the weekend that there were going to be 1 million test kits shipped to the United States. There have been all kinds of controversy related to testing. Initially, there were some people early on that got tested, and then they said they got these huge bills. It wasn't covered by their insurance company. We are now being told that all of the insurance plans, and these are Affordable Care Act or ACA compliant plans. So just as a quick aside, if you have one of these skimpy plans, short-term plans, they don't have to follow these recommendations. But ACA compliant health insurance plans, we're being told that they are going to cover the cost of testing for coronavirus. So, if you fit into the category of people who are deemed necessary to be tested, the financial cost of that should not be a concern to you. So, who should be tested? This is also a little bit fluid, but of course, if you have any known contact with anyone who has a known positive test for coronavirus, then you are going to want to contact your doctor and or your state health department to receive guidance about that. Please, whatever you do, don't just go showing up at your doctor's office. Don't just go showing up to your local emergency room, because doctor's offices and emergency rooms are now putting things in place because they are frankly becoming overwhelmed with the volume, and they want to be able to separate patients who are presenting for possible coronavirus infection from that 70-year-old woman with cancer on chemotherapy who is sitting in the waiting room and is immunocompromised, okay? So we really want you to call ahead, okay? If you think that you may have been infected, if you are having upper respiratory or lower respiratory symptoms and you are concerned that you may be infected, what they are recommending right now is that you contact your doctor and or your local state health department, and they should be able to give you some guidance. The test kits now are not just being offered in the health department and by the CDC, but we also have private lab companies, LabCorp and Quest are now also offering testing. But the sad thing is that the testing kits are still in limited quantity. So we do not have enough test kits in the United States for all of the people that need to be tested. And so what that means is that there are going to be people who are infected and that we don't know about. Okay. So again, this is why it's just so important to practice that social distancing. Again, to also review what we talked about, if you are having symptoms, you want to, cough into your elbow or cough into a tissue. Okay. Really, really important. No coughing out into the air, no coughing into your hand. You want to, wash your hands frequently with soap and water. If you don't have access to that, you can certainly use hand sanitizer. I talked last week about the proper way to wash your hands, so I'm not going to go into that again today. You want to frequently wipe those surfaces down, the frequently used surfaces, so your countertops in your kitchen, your sinks, your faucet handles, your doorknobs. Those are the things that you really want to keep meticulously clean, especially if you have someone in your home who is elderly, who has chronic illnesses, or who may be immunocompromised from an underlying condition. Okay. Now, if you have an older person or someone at risk in your home, let's say you live with your mom or dad, or they live with you, and you develop symptoms, what you want to do is to self-quarantine. And what that means is you want to separate yourself from the individuals in your home who are at risk, from the individuals in your home who are not currently infected. And so right now is the time to start developing, a plan for your household. Start to think about where you could go. Could you go in the basement? Is there an area in your home where you or someone else in the home who becomes ill could self-quarantine themselves? Ideally, if they have access to their own bathroom, that's also best. You want to find an area of the house. Many people are using the basement where you can just go, or the person who's sick can go and just be all by themselves. Obviously, they're going to need a source of food and water and things like that, but you really want to minimize contact between individuals who are sick and individuals who are not sick. Those types of things, self-quarantining for those who are ill, especially those with any known or potential contacts to individuals with the coronavirus, is extremely important. Social distancing is extremely important. Protecting yourself with frequent hand washing, making sure that you are limiting the distance between yourself and another person when you are talking, not hugging. All of those things are going to be incredibly important in preventing or quelling the spread of this highly contagious virus. Okay, I'm trying to make sure that I have covered everything. Look, if you guys, let me try to look and see if you all are asking me any questions, because I'm using Zoom right now and I cannot see your questions. So let me see if there are any questions. If you do have any questions or comments, I will be sure to come back to them and answer them. But I wanted to make this shorter than the one last week. And I really wanted to just make sure that you all had updated data and statistics, and that you had updated information related to social distancing and related to the self-quarantine. All right, last thing I want to say is that the death rate, again, right now that's being calculated is about 1%. So as we test more people, then that number has come down. So I think last week I probably told you all it was estimated to be around 2%. The flu, just for comparison, is around 0.8, 0.9%. But right now, because there are limited people who have been tested, the death rate is going to be falsely elevated. As we begin to identify more cases, we will see that some of those cases, many of those cases, are going to recover without any significant consequences. And so that's going to impact the death rate. But right now, they are still quoting 1%. All right, so I think that is it for today. Oh, one more thing. I didn't talk about masks during my last broadcast last week. You all have probably heard this, but just to reiterate, they are not recommending that healthy individuals wear surgical masks to prevent infection. And if you can even find a surgical mask, let me know, because now I've just been on an experiment. I'm here in Maryland. I've gone to multiple stores just to see, do they have masks? Do they have hand sanitizer? I haven't found a store yet in my area that has either of those things. but they are not recommending that those of us who are healthy and asymptomatic wear masks. They are recommending that if you are sick with active respiratory symptoms, that you wear a mask because that will prevent the spread as you cough and sneeze and things like that. But for those of us who are healthy, it hasn't really been shown to be effective. If you're not in the medical field, you're not accustomed to that. You're going to be touching the mask and probably self-infecting yourself. Also, there are gaps on the sides of those masks, so it doesn't protect you 100%. And also, guys, there are people out here who actually need those masks. There are home care nurses who need to be able to have access to masks. There are family members of ill individuals. So we don't want to hoard the supplies and the resources and take them away from the very people who need them the most. Okay. All right. So I just wanted to cover that because I didn't talk about masks last week. So I'm going to stop here. There's a whole lot more that I could say. I'm going to continue to post updated articles and other resources on my Facebook page. So feel free to come back for that. Again, please share this video with individuals in your circle who can benefit, especially if they are taking care of aging or ill loved ones. Let me know if you have any questions, drop those in the comments, and I will see you all next Monday at 8:00 p.m. Eastern Standard Time for the next episode of Navigator Nuggets. Again, I am Dr. Nicole Rochester, founder and CEO of Your GPS Doc. Thank you so much for taking the time out to watch this video, and I look forward to seeing you next week. Take care.